Good morning, everyone, and welcome to the second webinar of our series, Shaping Responsible Healthcare Ecosystems in Europe, in which we present the experimentation conducted in our three pilot regions, namely Örebro in Sweden, in the Republic of Cyprus, and in Murcia in the southeast of Spain, within the framework of our European project, CHERRIES. So this project, CHERRIES, is embedded in the H2020 program of research and innovation of the European Commission, and it focuses on constructing healthcare environments through responsible and research innovation. My name is Laure Razzo. I am representing the EU Business Innovation Center of Murcia in Spain, which is the entity responsible for the territorial demand-driven oriented policy experimentation, and it is a great pleasure for me to be moderating this webinar today. So this webinar is about promoting better healthcare services through co-creation. Patient and professional have a say. It's a very interesting title, and we will have the pleasure to have wonderful speakers. So let me introduce them. First of all, we will have Stefan Philipp, who is the coordinator of CHERRIES and is also a researcher of the Center for Social Innovation in Vienna. He is involved in several projects with a focus on problem-oriented innovation policy, regional development, and studies on social innovation. He deploys a broad set of qualitative and quantitative methods with a focus on data-driven research. Mr. Philipp holds a master's degree in spatial planning and also is pursuing a PhD at Université Paris-Est. Before joining ZSI, he worked as junior researcher at the Austrian Institute for Regional Study. So, hi, Stefan, welcome. And I'm very pleased that you are here today. So you will offer us an overall presentation of CHERRIES. So we will be really happy to listen to you. Then today with us, we also have Professor Nick Guldemont, who is a professor, doctor, is a professor healthcare and public health at Section of First Moscow State Medical University, and is also a senior researcher at the National Health Living Lab of Leiden University Medical Center. So welcome to Nick. Nick holds a degree in medicine and electric engineering. And during his career, he worked as a clinical researcher in numerous health innovation programs and is a key expert on digital health and integrated care for various governments and NGOs, multinationals, and startups. So today, Nick, you will talk about no transformation is possible without co-creation in health and social care. So we are really looking forward to listen to it. And as RI implies the inclusion of multidisciplinary stakeholders in the processes, here in Murcia, we count also with the regional government, who is a partner of the project CHERRIES and represented by the direction of European Union. And we are pleased to have today the director of this department, Adrian Zitelli, who is also alternate member of the Committee of the Regions for the region of Murcia, and has an extensive professional experience in various national and international companies, and specializing in recent years in the field of integrated management of real estate resorts, acting as assistant administrator and branch manager. He has also worked as an advisor on the boards of directors of tourist complexes and in the international action of various associations and entities with local, regional, national, and European public bodies. Welcome, Adrian. And we will talk with Adrian today about the citizen engagement, which is a key factor in the cooperation. And finally, we have the pleasure to welcome here Gorka Sanchez, who is responsible for innovation and Murcia Health Service, also partner of CHERRIES. And Gorka is a physician specialist in family and community medicine with more than 10 years of clinical experience in the emergency hospital and primary care. He also combined teaching and resident training coordinator and hospital specialist and also developed work management responsibility as coordinator of primary care team. Since 2010, he assumed responsibility at the central level, and he has devoted himself to developing standardization project and monitoring. So we are really happy to listen to his experience today, because he also have making a lot of success stories, participating of success stories such as CIMA app pharmacy, with a historical improvement in the efficiency of pharmacy in primary care. He also has been a main researcher in several European projects, such as Indemen or Firearm, and today CHERRIES. So Gorka will present the general overview on the healthcare here in Murcia, and also the experimentation that we are conducting within the project about the detection of the progression of the multiple sclerosis. So we are looking forward to listening to your expertise that I briefly presented now, and I leave the floor to Stefan for the CHERRIES presentation. Thank you.
Thank you, Laura. Thank you very much for this nice and very, very detailed introduction.
Stefan?
Yes. I'm not sharing the wrong screen. Or do you see my slides?
We see your slides.
Perfect. All right. As Laura said, I'm the coordinator of CHERRIES, and with this I will just take a very, very brief introduction around what is the context of our project. As Laura already said, I'm working at the Center for Social Innovation in Vienna. We're a non-university research center doing projects on the interfaces of science, society, and policy. CHERRIES is about responsible healthcare. What was our main reasoning when we were writing this project? There is an observation that in healthcare in general, pressures on the system are increasing. People are getting older, we have an aging population, chronic diseases, comorbidities are increasing, people need more care, need more continuous care, and also their quality standards, what they expect from care is increasing. This is creating pressure on public sector that is also facing budget restraints, so there is a need to provide more and better care for less resources, basically, which obviously is creating issues in the sector. Innovation in this context is often seen as a way of improving things, to create new products, new processes, new approaches in general to providing healthcare services that help the sector to maintain the high quality care or increase quality of the care while at the same time cutting costs. The problem is that there is evidence that healthcare innovations often, even though they prove that they actually can be successful, often are not adopted and not spread, or only adopted in a local context. So there is a big rate of failure when it comes to innovation in healthcare. From an economic perspective, because it's not picked up. And this is our issue that we're facing. And our hypothesis, so to say, is that when we go to demand-oriented approaches, taking demands up from the sector and co-create solutions with the involved stakeholders using RRI approaches, we can mitigate these issues. So that we develop solutions that are really fitting for the context, and there's a higher likelihood that they will be picked up. How do we do this in CHERRIES? We have this model. I just want to walk you through it very briefly. We have here on the left the need identification processes. We started talking with our stakeholders. We had, in context of COVID, everything was online, unfortunately. Talked with them, and then we had an open call for needs and saying, please report your problems that you're facing in your daily life. Where is something that should be handled better? We talked with patients, we talked with doctors, we talked with actors outside of the system, and it was a very open process. based on bottom-up identification of needs. We collected those needs. Each region had a selection committee and selected one need. This need was then transformed into a challenge. We had an open call for solutions. Organizations, mostly SMEs, were bringing us proposals, saying, okay, that's how we would tackle this issue. Again, the selection committees picked one solution provider, and the solution provider and the stakeholders who identified the need in the first place went through a co-creation process. This process is still ongoing, but we already see very nice things happening on the ground, so to say. Yeah? Okay, and in a wider context, we are also mapping and analyzing the regional contexts, seeing where kind of issues and potentials are in the region, and then we'll come up with recommendations for improving regional policies and strategies and so on. Another thing that we are doing is we are developing this model, we are testing it, but we also want to spread it. Also, like, we want to create a community. We have an open call for mirror territories that will get support from us based on trainings, travel expenses, and so on, to replicate the model in their own regions. If you're interested, you find information on our website. Deadline is end of October, but most likely we'll kind of extend it as usual with these processes. And our partner, Biomedical, who is also from Murcia, will guide you through this process if you're interested. And with that, I would like to close and hand over to the next speaker. Thank you.
Thank you very much, Stefan. Yeah, it's interesting for us also to validate the whole concept and methodology. And so, yeah, this call for mirror is also in line with the sustainability of the methodology. So we are really looking forward, a motivated region to be on board with us. Thank you. Nick, please, can you take the floor and talk about the necessary implementation of co-creation in the health and social care systems?
Yes, thank you very much, and thank you very much, Stefan, for the nice introduction. Yes, I think the topic is really more actual than ever a hot topic. Of course, it has already been for years. That is, okay, how can we stimulate innovation to co-creation and user involvement to make it more successful? Especially now with this pandemic, we have, it's like the things Stefan was explaining, the systems are already on pressure, and we know this already for so long. It's already for more than 10 years. We are forwarding governments that they should transform their healthcare systems into more person-centered, more integrated, because we know it will provide better outcomes, maybe not necessarily at lesser cost, but we know we can do better in terms of providing quality of services and better outcomes. And meanwhile, if we work better on issues like prevention and better social fabric and infrastructure, we might create better sustainable societies. But despite the sort of knowledge we've built up over the last years, also in terms of how do we build these sustainable societies and better healthcare systems, we weren't so very successful at putting them into practice. So it shows also the sort of complexities we have and from a policy perspective in order to make it a reality. But still, so the question is also, and that's what also Stefan was referring to, so how do we create a sort of environment, a situation where we can benefit from a co-creation approach? And one thing we know, if you don't involve the sort of users and other stakeholders, it won't happen. Because one of the explanations why the existing sort of approaches or models didn't work, either on a very operational service level or more on a systems change level, was that politicians policymakers, decision makers, healthcare organizations were just doing some pieces of the puzzle. While what we know for success, you have to sort of an integrated, holistic systems approach. You need to do both sort of top-down approach with policies and all kind of alignment of finances, rules, regulations, visions and strategies in order to know, for people to know, okay, what to do, what's the direction we're going, and what do you expect from us in more in general terms, as well as this bottom-up creativity and energy from localities. So I think one big thing still for many countries to work on is, okay, what should we have in place at the local level? What kind of infrastructure do we need in terms of co-creation, expertise, people who can support, moderate this process, how to involve citizens, patients in this process to learn about their needs, their local needs. What are the specific context-related issues? If you go to a neighborhood or a village in Murcia, it will be very different from maybe another part in that region, or in Spain. If you Basque country compared to Andalusia, it's totally different. So the local context is often very important in order to make the translation from needs to functional solutions essential. So good mapping of the locality. Okay, what's the current sort of context and situation? How the people are organized? How does the politics work? And how can you capitalize on existing infrastructure? So this is still a lot where we have to learn from each other on, okay, how does the sort of understanding work, and how do the processes work, and what kind of people you should have in place. And we have many lessons to learn from. I think also what we know is, if we are able to engage with people on a local, regional level, and they are part of creating the solution, and this is also part of the sort of adaptation, because if you are part of the development, and you're more likely to adapt it than just, okay, we have a nice solution for you. And that's also a sort of process which takes time. So it's not a sort of quick fix, which is done in a couple of months or with 1 or 2 co-creation sessions. Basically, it's a total new approach on how local authorities, solution providers, payers interact with each other over the coming years. And that's also why this, from an industrial side, where a lot of opportunistic companies have thought, okay, we can drop our solutions, we do a sort of user involvement, and that will stimulate the business and the uptake. Well, it doesn't work this way. It really needs a longer time investment and a lot of attention. So I think that's sort of local things we are learning, and we also created, or the European Commission has provided also networks by which we can collaborate, and CHERRIES is a wonderful example, I think, also in looking further beyond only health services of the technology, but also in more the lessons as regions we can share. And then slowly, okay, what is the higher system aspects? How they are related to the sort of local system? And there you come up, okay, how are the sort of rules and regulations, finances aligned in order to make this innovation happen? And this is something which is often more difficult for regions. Spain is quite decentralized, and regions are quite independent or self-sufficient. But many other countries are sort of semi-decentralized. So many aspects are depending on central governments or even the European Commission. when it comes to data sharing, finances, or what you can do in healthcare and social care. So if we really want to push forward this sort of local involvement and developments, it is important for governments to realize, okay, we should turn around and see how our policies and regulations are limiting or facilitating the sort of local activities. So that's a top to bottom down sort of thing. And this is not only true for making the implementation in reality, it is also true for upscaling. So if we don't want to have the pitfall of that we reinvent the wheel everywhere again, and we have to think smartly on how we can upscale one sort of solution or success to another region or another country. And this also requires a higher system aspect, sort of alignment and efficient information sharing and knowledge sharing. So this is really the responsibility of policymakers from governments, ministries, etc., including also private partners who can collaborate. I think one of the pandemic also made, for example, industries in pharma or medtech or health IT in Europe more aware of, okay, our traditional business models aren't last for the future if we go on like this. So we should find better sort of alignment with local adaptation and co-creation, as well as more sustainable sort of business models in which you look more at sort of outcomes and pay for performance, rather than sort of single benefit from a product or equipment. So I think there's a lot to learn, and I think this certainly will help, and it's one of the pieces I think we need. So that's very good. Thank you.
Thank you very much, Nick. I think you pointed out a lot of concept that we are developing under CHERRIES, and it's very enlightening, let's say, to see how the co-creation need investment, but not only financial investment, but also human investment, let's say. And in that regard, talking about the mapping, if the participants here wants to learn more about how we did that in CHERRIES, we did some territorial mapping in the 3 regions, because, as you said, the specificities of each region on a political way, on functioning, but also on the innovation itself, how it is conducted, who are the most innovative key people who can work on that. It's very important. So we have all the deliverables on our website, and I think it's really interesting to check this out. And also when you're talking about the adaptation in each territories, what we did in CHERRIES is the methodology is, let's say, we have guidelines, templates, but each region is can adapt it. It's a little bit flexible because of the specificities that we mentioned before. We thought that having a rigid thing, it's not obviously working. So we have the same framework, but adaptable. So I think it's also interesting to mention here for the interested mirror territories. So thank you very much, Nick. I will come back to you with a specific question later on. But now, as we said, policymakers are really key stakeholder in that process. So we are really happy that Adrian Zitelli is here today with us to present the initiatives of the regional government of Murcia. So please, Adrian, the floor is yours.
Thank you very much, Lore. It is a pleasure for me to share this morning with you all to discuss about this very interesting and exciting CHERRIES project. As you said, in particular, I will be sharing the policies and initiatives for citizen engagement and active participation currently in place at the region of Murcia by the regional government. Well, broadly speaking, participation is about actively taking part in something that affects or interests you. It is about getting involved in how things are done. A participatory government promotes the rights of citizens to actively participate in the development of public policies and to ease the path for public administration so they can benefit from the knowledge, ideas, and experience of its citizens. This participation has two positive aspects. It improves the measures of the public administration, and it also plays a relevant and leading role for citizenship when it comes to decision making. All these together enhance the democratic practices, and the citizen participation is also part of the RRI. Within the participation, within the actual role of in the regional government, the right of participation is contained in the Statute of Autonomy of the Region of Murcia. The Law of Transparency and Citizen Participation of the Autonomous Region of Murcia of December 2014 includes the right of citizens to engage in public affairs and establish instruments to articulate such participation. This law defines citizen participation as the individual or collective input made by citizens with regards to the design, implementation, and evaluation of public policies and actions through instruments and processes that allows them to communicate with public entities. And obviously the public administration of the region of Murcia is the actual scope of application and also the entities that make up this public sector. And you might wonder how this participation is shaped by the means of a key element, which is the platform for citizen participation. The Office for Transparency and Citizen Participation, which is the competent body for citizen participation in the regional administration, has established an online platform to enable citizen participation in decision-making process on subjects of public interest within our autonomous region. At this point, as you can see, my colleague Remedios is already sharing her screen, so you can check the platform website, and she will provide an English version of the link through the chat later on. This platform offers a series of electronic and interactive tools and resources to make citizen participation easier. Which are the models of citizen participation? First of all, the citizen input. The citizen input represents the most basic instrument of participation by means of which any citizen or citizen entity can make specific proposals concerning the public action of the regional administration, as well as assess those formulated by other citizens or entities. We also have the public inquiries, which are a structured procedure by which the regional administration probes and gathers the opinions, proposals, and suggestions of the citizens regarding a specific action or initiative of the regional government, partially or entirely, whose application directly affects the citizens. We also have the participatory deliberation, which this procedure, which is an initiative of the regional administration itself, whereby the opinions, proposals, and suggestions of citizens and civil society and their engagement in the design and assessment of different public policies, which are all gathered together. And finally, we have the participatory budget, which is a very important part where citizens can decide the destination of part of the public resources through participatory budgets. By doing so, we seek together the best solutions to existing needs. The platform posts and spreads the documents results of each citizen participation process and, where appropriate, the decision adopted by the regional government management care center regarding the citizen contributions gathered throughout the process. And finally, I would like to explain briefly two examples more focused on the health area that occupies today, in particular two participatory health processes that has been carried out recently. The first one is the Health Pact, which has been carried out in 2016, where the regional government promoted a public inquiry in the form of an online questionnaire in which some health-related fields and lines of actions were proposed with the aim of knowing the citizen opinion about this pact and to gather suggestions and proposals on the possible context from that point on. And the second one is the regional plan about addictions that went in a period from 2015 to 2020 of the region of Murcia, where a participatory deliberation was carried out in this case, and eventually consisted in an online public survey, which has a whole phase of public survey and a posterior debate. So thank you very much again for having me today, and and thank for all the other members of the board that are providing us such an interesting webinar this morning. Thank you.
Thank you very much, Adrian. Very interesting, and yeah, as to put the citizen in the center of the process is a real consideration. So it's very interesting also to see that CHERRIES is in line with this trend. So thank you very much. Now Gorka will present more in details CHERRIES here in the experimentation we are conducting here. That started, the whole CHERRIES has started at the same time as COVID, so it was quite challenging as in the other two regions, but I think we managed to follow the methodology and the steps. So Gorka, please let us know more about this.
Thank you. Good morning to all. I am going to share my screen. Okay, can you see my screen? Can you see my screen?
Yes, yes, we can.
Yes. Okay, okay. Good morning to all. I am going to introduce the Murcia ecosystem in CHERRIES project. Okay. Firstly, the region of Murcia is one small region in the southeast of Spain, on the Mediterranean coast. We are about 1.5 million inhabitants. It's around 3% of the whole Spanish population. And we are 4 entities involved in CHERRIES project. FAME as coordinator of our ecosystem, TIC Biomed as supporter of companies, region of Murcia, General Direction of the European Union as policies, as healthcare system, the Servicio Murciano de Salud. About healthcare system in Murcia, SMS, Servicio Murciano de Salud, is part of the regional Ministry of Health, is the public health care agency, is the largest company in our region, with around 23,000 workers, with 11 hospitals, with 85 healthcare centers, and with great experience in innovation, mainly by European projects like INCA, FICE, that was the e-health accelerator of Firewall, ProEmpower, for example, a PCP about looking for the integral solution for diabetic people. In demand as our pillar of the model of innovation in healthcare based on demand-driven, and currently Pharaon and CHERRIES projects. And this is thanks to this project, we has accumulated a great expertise in co-creation and SMS. And we are convinced about this sentence. And this sentence is the core of the co-creation demand-driven. The distance to the user is the distance to success. And with CHERRIES, this is the reason we started all projects at the very beginning from our needs, from our professionals. But with CHERRIES, we involve to the rest of the stakeholders in the society, like researchers from universities or patients from the association. Now, what about the CHERRIES milestone? We started with 3 webinars about RRI policies, about workshop, about the call of needs, in last autumn. Secondly, we started with the call for needs that was open three weeks in November. And finally, we selected the winning challenge in December. And this was the winner challenge, the winning challenge. The winner was Progress. It's a challenge about the early detection of progression in multiple sclerosis. And the objective of this challenge, this winning challenge, is to achieve the early detection of the progression in multiple sclerosis, applying sensors by IoT beyond the current face-to-face consultation with neurologists and nurses every 6 months. The need is to shorten the delay of the detection of these MS progressions, which is estimated by papers in around 3 years. And this progress was that the methodology of this progress is of the challenge is a prospective study with at least 30 patients during 5 months. The challenge teams is composed by local association of patients like EMACC, the Department of Neurology in Hospital of Cartagena in the Servicio Murciano de Salud, and the Department of Biomedical Engineering in the Polytechnic University of Cartagena. The development and validation of a solution for the collection, analysis, and monitoring of the daily activity is the objective of this challenge of this patient with multiple sclerosis. Why? Because the prevalence of multiple sclerosis is around 1 per 1,000 inhabitants, and multiple sclerosis is the main cause of the neurological disability in young adults. Patients and neurologists need a faster, more sensitive way to detect the MS progressions. We continued with the milestones in our project in Murcia. After the selected winning challenge, we wrote the requirements for solvers. And this was published by a call for solution for the companies, that was open 3 months since February until April. And finally, we selected the winning solver, that was this company, Grupo Pulso Ediciones, last May. And finally, we started the co-creation last June. This is the solution. The solution is called MS Progress, and it's based on IoT. Firstly, a Fitbit, a smartband, measures the variables and transmit this to the dedicated smartphone with an app who receives the variables and go to this data server with a kinetic algorithm. We can watch all the reports and the data visualization in a web platform. It's available for the primary care doctors, neurologists, and nurses. And what about the co-creation? We divide into main phases this co-creation. The pink color, you can see the first phase of co-creation about the design and about the develop of the prototypes. And after this, we have the 5 months for the pilot testing with 30 patients. And we are here exactly in the very beginning of this second phase of co-creation, the pilot testing, including this, involving these 30 patients. And we expect to have results next April. And this is a photo from last week with the first training session and with the develop of the devices to our patients in the local in the site of the EMACC Association of Patients with Multiple Sclerosis in Cartagena. and we are looking forward the best results of this from probably from April, next April. Thank you for your attention. I am glad to answer your question.
Thank you very much, Gorka. Yes, I think at the end of the session we will have time for questions. Now I will ask first of all maybe Adrian about the participation of citizens in the process you mentioned before. What would be for you, according to you, the opportunities that this kind of processes bring to at regional level?
Can you hear me now? Yes. Sorry, can you ask me the question again, because it was closer and I couldn't hear it well. Sorry.
Sure. And no, as you mentioned before, the participation of the citizens is a key element, and I would like you to explain what are the benefits you observed from this participatory process at regional level.
Well, obviously, every participation to involve people is the key element to raise a project from the paper to the execution. Is a key part of every project, is to bring people involved in, and obviously in this particular case, I understand that the most key part of this project is to actually elaborate a tool that it will be implemented and people will need it to create a need. It's all part of the actual demand that these kind of solutions might have on people, and especially on this particular subject, that it might be a needed to be addressed. And obviously in this participation processes, is key to actually feel the actual involvement or the actual need of the people at the ground level, that they will be eventually the final users of these solutions. And obviously it's also all part of the investments. If you want to invest in innovation of all kinds, not only economic, in the end, we have noticed is that the projects must go in parallel with the expectations and needs of the public, of the citizens, who are at the center of public policies. And more actors are needed to get involved in the research process from its inception through the development, through the achievement of results. These will reduce the gap between society and science. So therefore, the citizen participation, taking into account the needs that are demanded, are essential for innovation. And as I was saying before, the CHERRIES project is a clear example of this, as an example of the participation and RI. Yes.
Thank you very much, Adrian. It's true that here in Murcia, the team, the challenge proposer team, was composed by different actors who work jointly, but on a complementary way, because we had on one side the patient association, the healthcare professional, and then some research group to ensure that the challenge is built on these three parts of the needs. So yes, it is really interesting. Maybe Nick, you can also talk about is there any difficulties to work on a demand-driven approach in innovation in the healthcare systems?
Thank you. Yeah, I of course, there are many aspects which are challenging in the process, from a technology point of view, from a people's point of view, from financing point of view, and doing mostly work in healthcare and sort of healthcare improvement in terms of services, diabetes, cancer. I think with sort of people's involvement, it's also this: how do we reach those very difficult groups? which don't have the sort of socioeconomic background, well, education. How do we serve those and include them? Also beyond the set of medical needs, where we also know that typically these populations have a combination of all kinds of challenges related more socially, health related, and we can only solve this if we look at it from a broader perspective. So particularly for these groups, I think we need to support healthcare workers, but also policymakers or people responsible in government to work on, okay, how can we make this successful? And we also we have examples. There's evidence on how to do this. For example, in prevention and screening methods for chronic diseases, and also for this related to vaccines and reluctance to get vaccinated in these groups. So a lot of these challenges we know are very persistent and very difficult. How often there is experiences, experience where we can learn from. So that's, yeah, I think that's one important thing. So I focus on the people aspects, not on the other aspects, but yeah.
Thank you, Nick. Yeah, you mentioned the support to professional healthcare workers. I think maybe Gorka, based on your previous experiences in co-creation, maybe you could just develop a little bit of how to involve the professional and the users, and during from the beginning of the process, and how to maintain the involvement in these processes that we saw that can be quite long and can be a challenge too.
Thanks for the question. I think that this is key. I think the key is to introduce the call for needs as an open and competitive process. And this ensures not only the best need for your healthcare system, but the engagement of the winning team during the whole co-creation process later. They are going to feel in this way as entrepreneurs rather than workers. I think this is the key, the competitive approach, and open. It's not only RRI, it's very efficient and very key for the engagement of our professional.
Yes, indeed. What we experiment in CHERRIES is regarding the users. It was quite easy, let's say, to have the patient on board with the experimentation. They are quite motivated, and I would say, yeah, for the challenge itself. But it's also very interesting to see the professional. They are very also engaged in having new methods of working. And something that we notice also in CHERRIES, it's when we're talking about RRI, we also notice the changes that are needed and into the institution themselves, and how to work differently, so innovatively, let's say. So it's very interesting too. I think we are now in the question time, maybe. I don't know if we have any question in the chat.
No, I don't see any, but I would not have a question. I would have a comment basically to what Nick said, but it's also like in a broader context of what we are talking about today. I think that within healthcare, but especially also between other sectors like school and social services and so on, we tend to build silos. There is a very, especially in healthcare, there's a specialization. You have a specialist for this specific problem, and this generalistic, holistic view sometimes is missing. And this is also true like on a government level. And it's incredibly hard to break these silos and to cooperate between silos. So we are kind of observing what we call innovation literature a coordination failure sometimes. And in the end, healthcare is always a service. It's provided by a doctor to a patient and it should improve his life, his quality of life, and technology is an input to that. But if we develop only a new technology, a new input to this service and don't think what it does actually mean on the organizational level, how does it change the service itself, then we're missing a crucial step. And I think that's what was referenced by Gorka and also by Nick, how we can implement and adopt innovation in this context. So the organizational perspective, the people perspective, and then this is related to competences and preferences of the users and the doctors and the organization as such, and how well it can break these silos is very, very important in this context.
Yeah, thank you, Stefan. And also something that maybe we didn't outline that much, but it's really important to us is when we're talking about RRI in every stage, in every step of the project, in the goals, when we also selected both needs and the solution provider, we paid really attention to these principles of open science, gender dimension, and it's also really interesting to see how to change our way of working towards this. So it's also really interesting. If we don't have question, maybe some few words of conclusion from each of our speakers about the co-creation cherries, or what would be some key conclusion from your side? Maybe starting on my screen, it would be Gorka first. Sorry. Gorka, you're unmuted.
Sorry, can you hear me? Thank you. I think it's better to start from an unmet need proposed by users in order to guarantee market opportunities for your solution. The step-by-step validation from the very beginning ensures the accuracy of the product or the service, and the users involved in the co-creation will be your best reps. I think this is the key of the opportunity of this approach.
Yes, maybe in that regard, Nick, I wanted to ask you about the benefits of working in a co-creation way on impact and sustainability of the solution that we are developing, the innovation itself. When I'm talking about solution, can be social solution, of course, not only technological, even if here in Murcia we're working on the technological platform, but in Cyprus they're also working on e-health devices. But in Sweden, they are tackling the elderly loneliness, and it's more social innovation. So, what would be for you the main benefit in that regard?
Yeah, so I think, of course, we touched already upon many benefits from the approach, but I think also had the sort of benefit and lessons learned from just talking with each other and understand the sort of problems is also, I think it's essential eventually to adaptation and change, that you understand from other perspective, okay, what are the real issues and problems? Because if you put patients, doctors, nurses, etc. together, and they all have a different sort of view on the same problem. So this sort of understanding also creates a better understanding from each other. And this has also sort of, I think, a very deep benefit for the society as such, as to create social cohesion and more, sort of understanding and tolerance for other views and problems. So I think that's also in a larger perspective, particularly also on what Adrian was mentioned on this wider participation involvement. It's also an approach to work on benefit society as a whole. And maybe in conclusion also to mention that I think so we've learned over the last decade or more about what to do and all this co-creation and nice projects. But now it becomes more and more apparent that our societies have to change in energy, in climate, in health, etc., etc. So, and the pressure is building up. Less resources, less money available. So it's becoming more and more a reality that we have no other option than to change. So in that respect, it's really interesting to see how we going to deal with this. And also, I think there's so interesting things going on in the region of Murcia and other parts of Spain, but also in the Mediterranean countries, Croatia, the Balkans, Romania, Poland. So a lot of countries which has their own sort of particular challenges with the past and how it functions. I think there's so much where Western countries can learn from with their existing structures and often very fortunate in sort of economically, like the Netherlands. We can so much learn from these countries on how to change. So I think there's also European-wide a sort of mutual benefit from, listen to each other and work together towards this approach.
Yeah, thank you, Nick. It's true that CHERRIES is embedded it's a science for citizens action. So yeah, it becomes a key element. It's true, and what you say about the cross-cutting, let's say, exchanges. It's true that the European project and CHERRIES in that regard has also a focus on the stakeholders' vision and exchanges between the region themselves. So that's why we have these 3 pilot territories, just to implement a methodology, a common one that can be applied in different territories with its specificities and what will be the recommendation we can have. And also when you talk about the rest of the sectors, not only healthcare, just to mention that the call that we have that is running now is not focused only on healthcare sector, but we mean that any other sector with a demand-driven approach can apply. So thank you very much. Maybe Adrian, do you want to give a conclusive words also?
Yes, thank you, Laura. Yeah, I think following Nick's conclusions, we, especially in citizen participation and to actively involve the citizens in this kind of project, we are facing a similar challenge as the rest, or in line with the rest of the European challenge, is to involve citizenship more, because we know that we have implemented all these citizen participation processes, but not always has been easy to involve people to participate on them. And I think this is key for not only for this project, but saying in line with the participation of the citizens in a more actively way in European policies and projects, and to be more involved and to be part directly of this. And it's also linked to the participation in this kind of technological conversion that we are, the digitalization, the challenge, one of the biggest challenges that Europe has at this point is the digitalization, and this is all part and reflected, I think, in a it's like a Petri mirror or a Petri glass. We are facing possibly the same challenges that at European level we're all facing as countries. So it will be good to contribute to that, and if we can find a way, and as Nick was saying, if we can use the processes that we are developing here in other places of Europe, we are apart from helping the CHERRIES project to be successful, we're also helping to make a Europe more cohesive and to work all together in the same line with the same objective, which is to have a prosper Europe. So I think we can all congratulate on that, and we have a big challenge ahead. But from the region of Murcia, I can guarantee that we have our full compromise for this task.
Thank you, Adrian. Stefan, as coordinator of this project, we are all together thanks to you. So please let us know what would be your conclusion of this webinar.
My conclusion of this webinar now, I think what we are seeing, like a very general trend when it comes to innovation in healthcare, is that the science push model it's still important, of course. Yes, science is the foundation. But we're observing a little bit more of a market pull mechanisms as well with this demand orientation. These are not two pure forms. There is always a mixture between those, but I think in healthcare the demand pull is getting more important over the last 10 years. And what we are having with CHERRIES is a model that is starting at the very fundamentals. We are really defining the problem together with patients, with doctors, with citizens, and this is the highest form of participation. And they are involved in the co-creation. It's really a very, very substantial form of participation that we are doing here. And I am really happy to have Murcia, the region of Murcia, on board, because they are having these experiences and they are working with these models, and they show that they work really well, and we can learn extremely well from the experience. So this is a good case, yeah, for how it should look in the future, I think, and yeah, we will continue on that.
Okay, thank you very much to all speakers. It was a great pleasure to have you on board. Thank you for sharing your expertise and knowledge. And I just remind that we have 2 calls running now. We have one for, as I mentioned, various times now, the call from Europe, but we have also another one who is directed to solution providers in the region of Orebro. So you can check the details on our website, and it is opened until December, if I'm not mistaken. So this is a good opportunity to work on social innovation. Thank you very much, and have a nice day.
Thank you too. Bye.
Bye.